Okay, we're back on the Morning Brew. Always a real privilege to have our good friends from the UNM Cancer Center come down and visit with us. And today we have two folks with us today. Dr. Tom Schrader, who is Medical Director of Radiation Oncology at the UNM Cancer Center, right over there. Nice to meet you, Dr. Schrader. And Eder Calderon, who's a physicist at the Cancer Center. Good to meet both of you. Thank you for coming.
Thank you for having us.
Thanks for having us on.
We're going to talk about something called stereotactic radiosurgery.
Yeah, so stereotactic radiosurgery is, it's actually an older development. It's been around for a number of years, invented back in the 50s by a neurosurgeon, a Swedish neurosurgeon. But here in New Mexico, as you know, we have a relatively new cancer center. I think it's been there for about 4 or 5 years. Yeah. And we have just gotten around to getting that up and running, that sort of technique up and running at UNM.
Wow. Yeah, I've never heard of anything like that.
But it's obviously brand new technology, updated to 2014 standards.
That's correct, yeah.
We're not in the 50s, back there with some old clunky machine, right?
That's right. We're using our state-of-the-art machines to perform this technique. The technique is rather old, but our newer machines make it a lot safer and make us be able to deliver it in a lot more effective fashion.
So as I'm reading about this is like a tiny pinpoint X-ray beam that focuses on a very tiny area of cells, cancer cells, that the machine can be aimed at.
That's correct. So this treatment is designed to treat lesions or cancers inside the brain, and this requires great precision. Also, it's different from the normal way that we give radiation. When we traditionally give radiation, we're giving one treatment a day, 5 days a week, usually for a number of weeks. When we do it with the stereotactic radiosurgery, we're condensing all of that treatment into a single event, a single treatment.
Oh, wow.
So we give a very, very high dose, and we want to be able to focus that very high dose right down to the tumor so that we're sure we don't cause any problems with other parts of the brain.
So this is a much more preferred treatment.
Yeah, so the reason this is nice is because when you're working with radiation in the brain, there can be toxicities associated with those. And some of those can sometimes not be great for quality of life. Usually it can cause memory problems and hair loss, things like that. When we use this more advanced, more precise form of radiation, we don't usually have those problems. And we can just focus down very tightly on the area that we are interested in. And it's that part that's the difficult part. Yeah. So we're talking about being able to administer this radiation really down to a pinpoint area with sub-millimeter accuracy. And that's where Eder comes in.
Yeah, and I'm interested in, you have a great job title. You're a medical physicist. Yeah, what does that mean?
As a medical physicist, I am primarily responsible for making sure that the machines that we use to treat our patients are calibrated properly.
Okay. I see.
Meaning that they're delivering the correct amount of radiation. And making sure that before a patient's treatment starts, that we perform all the appropriate checks.
Okay.
So that's my main job.
Fascinating. Couldn't happen without you.
Yeah.
Actually, that's been probably the part that's the hardest with this. So getting our machine up and running so that we have that kind of millimeter precision, and testing it over and over again, because this is the kind of thing where when we're given just one big dose like that, you don't really get a second chance. You can't tune it up for the next treatment. It's all in one thing, and so we have to make sure that we've got that kind of precision, and that's what Eder and the rest of our physics group at UNM has been doing really over the last 6 months to a year to make sure that we can deliver this treatment accurately.
I'm just curious, how long do those treatments take for cancer patients?
So the treatment is a rather involved thing. Most of it, however, is planning and getting set up for the treatment.
I see.
So the first is what happens is a patient comes in, and the first thing we do is we have a neurosurgeon, and the neurosurgeon attaches a head frame to the patient. And what this is it rigidly attaches to the skull. And this is important because when we're getting the treatment, when we're administering the treatment. We don't want the patient to move.
Right.
And so this, excuse me, this helps them to stay perfectly still. Once they've got that, we then perform a CAT scan of them in the position we're going to treat them with the head frame on. And we use the head frame and the CAT scan in order to design the treatment. So meanwhile, the patient's sitting around with the head frame on while we're doing all these calculations.
Right.
And that's probably most of the treatment or the time involved is in that planning phase. And that's where Eder and the rest of the physics group is doing all their checks and designing the treatment. Right. And then once we've got it all perfectly planned and we're ready to administer the treatment, that's when we move forward with the treatment, and the treatment's short. It's usually about 30 or 40 minutes.
Oh, okay. That's
Fascinating stuff. It's called Stereotactic Radiosurgery, and Dr. Tom Schrader with the UNM Cancer Center with us today, along with Eder Calderon, medical physicist with the UNM Cancer Center. Fascinating stuff. Thank you, gentlemen.
Thank you
for coming
so
down
much.
today. Great job. Back in a moment with more Morning Brew right after this.